Hello, my name is Sarah Cruz, and this presentation is regarding application of population health surveillance data. Introduction. Community Health Assessment, CHA, is to provide information for problem and assess identification and policy formulation, implementation, and evaluation. Furthermore, collecting comprehensive data for a community is essential because it helps understand the health status and the root causes that affect the local public health system and the community. Below are the web links that were used to find the data for the health assessments. According to the San Bernardino County, our community vital signs file data reports that chronic disease such as heart disease, cancer, and diabetes are the leading causes of death and disability in the United States. In Bernardino County, the key indicators ranks chronic respiratory disease as the 48th, coronary heart disease as the 47th, and all types of cancer as the 42nd. In addition to obesity is another chronic disease that has increased in San Bernardino County. Since 2017, it has increased from 28.7% to 38.1%. Furthermore, the county faces other chronic diseases that show a high mortality rate. The next health indicator is mental health. Mental health is just as important as physical health. Mental health is closely connected to physical health and substance abuse. When a person is experiencing a mental health disorder like depression and anxiety, it can reduce one's ability to participate in health-promoting behaviors such as eating, exercising, and minimizing use of alcohol and tobacco. Mental health. The San Bernardino Health Indicator for Mental Health reports that in the last 6 years there has been a decline in mental health services. Additionally, individuals living in poverty level and low income level are not receiving mental health services as they should be. The mental health for older adults has increased, whereas children has not changed. Lastly, suicide rates have not changed since 2019 in the San Bernardino County. The next health indicator is infectious disease. In San Bernardino County, under the Public Health Department, the Communicable Disease Section (CDS) performs disease surveillance, implements infection control disease, provides education and to reduce the rate of infectious disease that correlates with the California law. Infectious disease. The data, trends, and reports on communicable diseases in San Bernardino County are from 2012 through 2024. In the year 2012, the race and ethnicity that had the highest cases were Hispanics or Latino, 220 cases. Throughout the years, cases changed. However, by the year 2024, the race and ethnicity that remained the highest was Hispanics or Latino, 432 cases. Furthermore, in the year 2020, there was a total of 830 infectious cases recorded, whereas in the year 2024, there was a total of 1,292 cases recorded. The last health indicator to be presented is behavioral health. A health improvement priority for an individual is behavioral health. Behavioral health is related to mental well-being and the prevention and treatment of mental health conditions and substance use disorders. Generally, behavioral health falls on a spectrum from illness to wellness and can change over a person's lifetime. Furthermore, behavioral health is connected to physical health, social, and economic well-being. Individuals who have behavioral health conditions are more likely to develop heart disease, diabetes, unstable employment, insecure housing, or involvement in the criminal system. Behavioral health. The following data is collected from the San Bernardino County, California. The county is experiencing an epidemic of drug overdose death. From 2018, it has increased from 9.4% to 30.2% in 2022. Furthermore, adults 18 years older living in San Bernardino have reported poor mental health in the past year, 16.1% in 2001, which is a significant increase from 12.1% in 2021. Additionally, drug abuse has increased significantly. Since 2000, there has been a 200.0% increase in deaths involving opioids. Lastly, suicide ideation in San Bernardino County increased 56.0% between 2016 to 2021. The following are the references that were used in the data collection.